How to diagnose peritoneal mesothelioma. Peritoneal mesothelioma, treatment, prognosis, and diagnosis. 1. Overview. What is peritoneal mesothelioma? Peritoneal mesothelioma is a form of cancer caused by asbestos. When asbestos fibers are ingested or inhaled, they can become embedded in the lining of the abdomen. Research suggests the fibers reach the abdominal lining through the digestive or lymphatic systems. Peritoneal mesothelioma is the second most common form of mesothelioma cancer, accounting for about 15 to 20% of all diagnoses. Each year, about 500 people are diagnosed with the disease. Common symptoms include abdominal pain and swelling, weight loss and fluid buildup in the abdominal cavity. Diagnosis consists of a series of tests, including imaging tests, blood tests and biopsies. Peritoneal mesothelioma is treated with surgery, heated chemotherapy and immunotherapy. Peritoneal mesothelioma prognosis may vary depending on an individual's case, with life expectancy ranging from 2 to 6 years. 2. Prognosis. What is the prognosis for peritoneal mesothelioma? The life expectancy for peritoneal malignant mesothelioma cancer is more favorable than other types of malignant mesothelioma. Peritoneal mesothelioma prognosis may vary depending on an individual's case, with life expectancy ranging from 2 to 6 years. More patients are surviving 5 years or longer with advancements in treatment. Survival of peritoneal mesothelioma patients treated with CRS plus HIPEC. 1-year survival -86%. 2-year survival -77%. 3-year survival -59%. 5-year survival -59%. Several factors can influence an individual patient's prognosis, including cell type, histopathology, tumor size and staging, gender and age of the patient. Epithelial cell type is most common in peritoneal mesothelioma. It is slower to metastasize, spread, and responds more favorably to treatment, with a median life expectancy of 54 months. A small percentage of peritoneal malignant mesothelioma patients are diagnosed with sarcomatoid cell type. This type can metastasize quickly and does not respond well to treatment. Peritoneal mesothelioma patients diagnosed with this cell type have an average survival of 4.6 months. 3. Symptoms. What are the symptoms of peritoneal mesothelioma? Peritoneal mesothelioma symptoms can take 10 to 50 years to appear after an individual inhales or ingests asbestos fibers. The fibers become lodged in the peritoneum, the lining of the abdomen, which leads to irritation and scar tissue buildup. These damaged cells can develop into tumors and cause symptoms. Peritoneal mesothelioma symptoms: abdominal pain, abdominal swelling, anorexia, weight loss, fever with no known origin, fluid in the peritoneal cavity, peritoneal effusion, hypercoagulability, blood clotting, inflammatory lesions, intestinal obstruction, night sweats. For most patients, early peritoneal mesothelioma symptoms will typically present in the abdomen or gastrointestinal system. Patients may also experience systemic symptoms, such as weight loss, which can further complicate diagnosis. Resources for peritoneal mesothelioma patients. 4. Diagnosis. How is peritoneal mesothelioma diagnosed? A peritoneal mesothelioma diagnosis consists of a series of tests. Diagnosis often starts with imaging tests, like CT scans and X-rays. These tests can rule out more common diseases and other forms of cancer, like adenocarcinoma and ovarian cancer. If a tumor is detected through imaging tests, a doctor will order blood tests to identify biomarkers that can further differentiate mesothelioma from other cancers. Biopsies are the only way to confirm a peritoneal mesothelioma diagnosis. A doctor will take a fluid or tissue sample to confirm the cancer. The biopsy can also identify cell type and mesothelioma progression. 5. Stages. Peritoneal mesothelioma stages. When diagnosing peritoneal mesothelioma, a doctor will also determine the stage of the cancer. Although there is no well-defined staging system for peritoneal malignant mesothelioma, doctors may identify the advancement of the disease with relevant criteria. For example, doctors may identify if the cancer has metastasized to other organs or lymph nodes. In some cases, doctors may also rely on a tool called the Peritoneal Cancer Index, PCI, developed for abdominal cancers. With this method, the abdominal region is split into 13 distinct sections and scored on a scale of 0 to 3 based on the presence and size of tumors. The 13 sections are then totaled for an overall PCI score, with 39 being the highest. Doctors suggest peritoneal mesothelioma stage is equivalent to the scores. A higher PCI score indicates a more advanced stage of abdominal mesothelioma. 6. Doctors. Peritoneal mesothelioma doctors. Finding a qualified mesothelioma doctor is one of the most important decisions someone diagnosed with peritoneal mesothelioma can make. Many of the best doctors work in dedicated cancer clinics across the country. Some of those doctors also conduct clinical trials to study new therapies and methods of treating and diagnosing mesothelioma. 7. Treatment. Peritoneal mesothelioma treatment. Peritoneal mesothelioma is often treated with a multimodal approach, which combines conventional treatments like surgery, chemotherapy and radiation therapy. Traditional chemotherapy and radiation therapy have shown limited success in peritoneal mesothelioma patients, with many clinical trials showing a median survival time of 1 year. However, some studies indicate success when using chemotherapy during surgery to treat peritoneal mesothelioma. For patients with advanced stage peritoneal malignant mesothelioma, standard treatments may be used as palliative care. Palliative treatments are used to improve quality of life and extend life expectancy. Minimally invasive procedures, like paracentesis, are often used palliatively. This procedure removes buildup of fluid and relieves symptoms associated with peritoneal malignant mesothelioma. Clinical trials are continually testing new treatments for peritoneal mesothelioma. Emerging treatment options include pressurized intraperitoneal aerosol chemotherapy, PIPAC, a chemotherapy applied in a pressurized form. Treating mesothelioma with PIPAC is in early phases and requires further testing. However, the treatment has shown a median life expectancy of approximately 27 months. Hypothermic intraperitoneal chemotherapy, HIPEC. For eligible patients, a combination treatment of debulking surgery combined with heated chemotherapy is becoming a standard of care. The heated chemotherapy, known as hypothermic intraperitoneal chemotherapy, HIPEC, is applied to the abdomen during surgery. Doctors perform debulking surgery, also known as site-reductive surgery, prior to HIPEC to remove visible tumors and tissue that have been damaged by mesothelioma cells. This may involve removing the abdominal lining or other organs in order to remove as much of the tumor as possible. HIPEC is then applied throughout the abdominal cavity to kill any remaining cancer cells. The heated chemotherapy is applied at 104 degrees Fahrenheit to 109 degrees Fahrenheit and consists of a stronger dosage than traditional chemotherapy. Clinical trials have shown the effectiveness of the treatment, with life expectancy ranging from 53 to 92 months. Data suggests approximately 65% of patients survive 5 years or longer. Because HIPEC is a specialized treatment, it is available at select cancer centers. Patients should also be aware of treatment costs as they make treatment decisions. Recent estimates show that surgery with HIPEC can average $40,000. 8. Common questions. Common questions about peritoneal mesothelioma. Is peritoneal mesothelioma curable? There is no cure for peritoneal mesothelioma. There are treatment options available that may improve life expectancy. How long do peritoneal mesothelioma patients live? A peritoneal mesothelioma patient has a life expectancy of 2 to 6 years depending on stage at diagnosis. What are the symptoms of peritoneal mesothelioma? Some common symptoms of peritoneal mesothelioma are abdominal pain, abdominal swelling, weight loss, fever, fluid in peritoneal cavity, intestinal obstruction, night sweats and hypercoagulability. Can peritoneal mesothelioma spread to the lungs? Yes, peritoneal mesothelioma can spread to the lungs. This process is called metastasis. How is peritoneal mesothelioma diagnosed? A biopsy is the only way to definitively diagnose malignant peritoneal mesothelioma. Other diagnostic tests like imaging scans and blood tests may be used to confirm the tumors. What causes peritoneal mesothelioma? Peritoneal mesothelioma is caused by ingesting aspartate